Horses belong to the family Equidae and are non-ruminant herbivores. The Equidae family includes horses, donkeys and zebras. India has a 0.3 million horses as per 2019 livestock census. Horses are intelligent animals and are used for transportation, horse racing, and also maintained as companion animals. Horses typically live in herds, and the behavior of each horse helps to achieve stability within the group. Horses communicate mostly through visual communication. Horses are usually kept in individual stables of 10 feet by 12 feet, and only mares with foals are housed in large stables which are double the size. The horses spend a significant amount of time in their stalls, and hence the flooring should be non-slippery. The roof of the stalls should be located at a minimum height of 13 to 14 feet. The sheds must be well ventilated with sufficient feed and water troughs. The stalls usually contain a layer of absorbent bedding material such as straw or sand or wood shavings. A horse is tied usually to a ring in front of a hay manger. The stables need to be cleaned daily, and the soiled or wet bedding is to be removed. All horses should be provided with as much free exercise outside the stable. The foals and yearlings need to be exercised in paddocks for normal bone development and for overcoming stable vices. Fenced paddocks may be set up for 4 to 5 horses to gallop. Chain link fencing, wooden fencing, or electrical fencing is advocated for horses. Resting without any exercise can cause stress in horses. The turnout of free exercise time has been found to have positive effects on horses' behavior. Horses' physical and behavioral needs are best met when they live in groups. With regards to feeding, good pasture provides both an excellent source of nutrients and the opportunity to exercise. A horse needs more land for grazing in dry climates. An average of 1 acre is needed for 1 to 2 horses for foraging. Providing horses with good nutrition is essential for normal growth, reproduction, and performance. A horse or pony needs approximately 1.5% to 2.5% of its body weight per day, depending on its age and level of work. Feeding includes grass or hay and concentrates such as grain or commercial pelleted feed. If a horse is not on pasture, it is recommended to feed them in small quantities at least 4 times a day at regular intervals. A 400 kg horse should be fed with 10 kg of feed per day, of which 5 kg should be forage. The concentrates fed to horses include all grains and commercial grain, byproduct feeds like wheat bran and rice bran. Horses usually consume adequate levels of vitamins if their diet includes fresh green forage and or premixed rations. Water is the most important nutrient in a horse's diet, and fresh clean water should be provided at all times. A minimum of 40 liters of water is required for a horse weighing 400 kgs. Horses should be groomed daily for healthier and attractive coats. Curry comb or dandy brush are used commonly for grooming. Grooming the horse serves two functions. It removes excess dirt and hair to produce a better coat and good blood circulation. The legs of a horse is very important, and more attention should be given by way of regular brushing of legs for observing any problems like swelling, lacerations, or skin problems. The teeth of horses need to be examined once in 6 months by a veterinarian for any problems in the teeth. With regard to the hoof, all the 4 feet need to be cleaned regularly to prevent lameness and various hoof diseases. Usually, clippers are used for hoof trimming. A professional farrier is usually employed for routine hoof care, and trimming is carried out every month since the hooves grow fast. The general examination should start with the observation of the horse from a distance in order to detect abnormalities that might be obscured by handling and restraint. Examining the horse from nose to tail along the left side and then tail to nose along the right side is one way of ensuring a complete general examination. The physical examination of the horse may be either generalized or focused. The external physical examination includes checking mares for symmetry and airflow. The mouth is examined by applying light pressure to the upper corner incisor teeth for capillary refill time. The eyes should be examined for corneal scars, conjunctivitis, cataracts, etc. Feel the pulse of the facial artery as it passes along the ventral border of the ramus of the mandible. A rapid, thready or weak pulse may indicate a patient going into hypovolemic shock. Evaluating the pulse may be a more valuable assessment of cardiovascular status than taking the heart rate directly via a stethoscope over the heart. It is important to check the nostrils and mouth for odor, since this is often associated with the presence of anaerobic bacteria which may be contributing to an infection. This is also a good time to listen to the horse's breathing, noting any abnormal noises. Most often, a gastrointestinal physical exam is performed in cases suspected of colic. Colic simply means abdominal pain. Horses have a low threshold for pain. It is an easy parameter to obtain from a distance. Observe for any sweating, quivering, flared nostrils, dullness of eyes, position of the ears, rolling, biting at the flank, kicking at the belly, or stretching. Rectal temperature is a critical parameter. Most colicky horses do not have an increased rectal temperature, thus, this finding may help to rule out luminal or extraluminal GI obstruction. Conversely, a colicky horse with a septic or infectious condition can have an elevated temperature, usually from enteritis or peritonitis. The jugular vein is used most commonly for venipuncture and intravenous injection. Both sides of the neck are used for intramuscular injections. Normal values for adult horse. The normal gestation length of mares an average of 338 to 345 days. The mare's udder begins filling with milk 2 to 4 weeks prior to foaling. The mare becomes anxious and restless and may kick at her belly, pace, lie down and get up, look or bite at her flanks, and sweat. She may frequently raise her tail and urinate. Most mares foal without difficulty. Wrap the mare's tail with a clean wrap when the first stage of labor is observed. The mare's udder, vulva, and hindquarters should be washed with a mild soap and rinsed thoroughly. Provide adequate bedding. The first stage of labor begins with the onset of contractions and generally lasts 1 to 2 hours. The fetal membranes may become visible at the mare's vulva and the sac breaks, signaled by a rush of fluid. The second stage is the actual expulsion of the foal. Normal presentation of the foal resembles a diving position, with front feet first, one slightly ahead of the other, hooves down, followed closely by the nose, head, neck, shoulders, and hindquarters. The third stage of labor begins after delivery and during which the afterbirth placenta is expelled. Once foaling has occurred, the breathing of newborn is to be observed. The foal will make attempts to rise within 30 minutes following its birth. Foal should stand and nurse within 2 hours of birth. It is essential that the foal receive an adequate supply of colostrum. A foal must receive colostrum within the first 8 to 12 hours of life in order to absorb the antibodies. Some of the common disorders affecting horses are colic, laminitis, and parasitic infections. Horses require annual vaccination for various diseases, namely rabies, tetanus, and equine influenza. Usually, all horses suffer from parasitic infections and periodical deworming is recommended. The common parasites found in equines are roundworms, tapeworms, and strongyles. Young veterinarians who aspire to be an equine vet need to acquire knowledge not only on treatment but also on general management like housing, feeding, pasture management, health and disease prevention, etc. Equine vets are in demand and are well paid. Equine vets have good employment opportunities in stud farms, research laboratories, nutraceuticals, farrier supplies, equine hospitals, race clubs, show industries, etc.